Bem-vindos a mais um videocast da Sociedade Portuguesa dos Farmacêuticos e Cuidados de Saúde. O meu nome é João Gonçalves e estou aqui com o professor Arnold Vulto a falar um pouco sobre biossimilares, o futuro dos biossimilares. I will pass to English. So, Arnold, thank you very much for coming to this meeting. And one of the most important things about biosimilars at this moment is to think about the future of biosimilars. So we know what are biosimilars. We know the variables implicated in how the biologics how they do their pharmacokinetics, pharmacodynamics, clinics, etc. But what is most important now is to think about the future and how biosimilars can really survive in the future and be really one big opportunity for patients.
Well, Joe, it's the reason why I'm concerned about this is that we see an evolving discussion in the biosimilars. In the beginning, people didn't know what it was. They had their doubts about the quality. Then there was a discussion on the efficacy and the safety. Then we had a whole discussion on switching, interchangeability. But slowly now, at least in Western Europe, biosimilars are becoming a success for healthcare systems, for patients. But there's a downside to it. For certain molecules, the competition is so fierce now. If we look, for instance, for infliximab, if we look for adalimumab, bevacizumab, there are so many competitors now that the prices, there's an enormous price erosion. That price erosion started in 2018 when the patent of Humira expired, and all of a sudden, almost at the same time, 5 or 6 biosimilars entered the market. And they all wanted to have their share. And the way to do it was competing on price. The result was that the price went down not 50, 60, but sometimes 70, 80%. And that alarmed decision makers in the boardroom of pharmaceutical companies. At that price level, they said, we cannot take responsibility for an investment of 100 million or more to develop a biosimilar, because that's what it cost. So, and another 6-7 years of research. So what we see now is that after 2018, there's more hesitancy for companies to develop biosimilars. And IQVIA rang an alarm bell in December 2022 in a meeting with the European Commission, when they said, well, if we look now, between now and around 2030, we see that for important molecules that have expiring patents between now and 2030, there are no biosimilars in the pipeline. That means that the forces that were shaping the market to make drugs more accessible and more affordable will dry up.
So you think that what we are seeing now is basically what we had until now in pipeline, and now in the next few years we are not having biosimilars being developed in the pipeline?
Well, what we see in the pipeline now are the compounds that the decision to develop them was made before 2018. For instance, we saw today that there are 5 or 6 ustekinumabs biosimilars in the pipeline. Yeah? But when they come on the market, there will be fierce competition, and the earning potency of such biosimilars is going down. And after that, well, for the real high market drugs like Keytruda or so, we will have biosimilars. But again, if there are too much, there's no viable market for them. But for the less high turnover molecules, products, no biosimilars are coming. And that means that we as healthcare systems, we just have to pay the high price of the innovator medicine because there's no competition.
Right.
And I'm worried about that.
What you're saying about the future of biosimilars is very important, about this competition that might disappear from the market. Another thing that might occur, since the price is so low that the margin of these companies will be so low that they cannot really build the market. So at the end of the day, the biosimilars might be a commodity. Do you think this is also a danger?
Well, I don't think it's a problem that the biosimilar becomes a commodity. I think there will be no biosimilars at all for certain compounds. And we as partners, stakeholders in the market, we have to take responsibility. And our research has been pointing at two major factors. First of all, the stakeholders are only working in their own interest. The patients want to have the compounds at the lowest price. The hospital wants to have the best price. The company wants to make a profit. The doctor wants to have freedom of choice. And they all look from their own perspective, and it's a silo thinking. And I think they should collaborate, sit together and say, well, how can we make sure that this market is going to survive? Mm-hmm. How can we behave responsibly and not just going for a race to the bottom for the price? And the second thing is, I've noticed, is that most systems, countries, have short-term vision. So they make a contract for 1 year, they try to get the best out of it, and after that, well, après moi la déluge. Mm-hmm. Insurance companies, other managers are there, and they just try to squeeze the maximum out of the market, and they leave it, well, to the successor, well, to pick up the rubble. And I think when you talk about biosimilars, you need to have a long-term vision. Don't try to maximize your saving the first year. No, try to design a policy that guarantees a healthy price for patients, for health systems, and for the industry for at least 5-6 years, so they can recoup their investment. And if we don't do it, we see it actually happening. IQVIA was reporting that for more than 50 biosimilar projects, they noticed they have disappeared, they have stopped. Mm-hmm. Yeah? There are important companies that are stopping the biosimilar business. They have left the field. Big companies, they just say, well, we stopped doing it. Right. So I see a very unhealthy situation occurring now.
Right, now we are seeing like a big market like United States coming to the biosimilar field, and they are getting more and more biosimilars approved. They have at the moment 22 biosimilars, I believe. So do you think that this strategy of collaboration is occurring also there? Because what might happen in the United States might be affecting all the world, because they are a large market. So do you think this strategy of collaboration or the drying out of the competition, which of the two will be occurring in the United States?
Well, in the United States, what I see happening, and Stanton Meer, who is a consultant who is reporting on these things on a regular basis, Stanton Meer actually issued yesterday a message where he showed that for pegfilgrastim, a long-acting filgrastim compound, that the competition now in the US is so fierce that the prices are diving under a sustainable level. So the same thing is happening there. Especially for those compounds that are, let's say, 3, 4, 5 offerings. They have to survive in a tendering market.
Right.
So I'm afraid the same thing will happening there.
And the last question that I would like to pose you relates to one word that I like a lot, which is innovation. Of course, you can do innovation in original drugs, but we might see also, and we know that innovation also occurs in biosimilars. Should the biosimilars promote more their innovation? What is the role of innovation in biosimilars in the context of this promotion of biosimilars?
I see different types of innovation with biosimilars. The first one is that with biosimilars, all of a sudden we can develop new indications. For instance, the treatment of inflammatory bowel disease in children. That landscape is completely changed now. Now the cost of treatment has gone down. And that is a crucial thing. We are giving back children back their lives, actually. So that's one thing. The second thing is there's also a lot of innovation going on in formulations and in added value. So in our research group, we tend to talk about best value biologicals. On the first sight, biosimilars all look the same. Yeah? They have the same, well, very similar molecule, the same efficacy and safety. However, they may have added values in other aspects, like stability, the formulation. With subcutaneous injections, there may be difference in injection devices or injection pain. And that's why we published in December a paper in the December 2022 in the American Journal of Health System Pharmacists with our group, where we're giving advice to hospital pharmacists to make a choice for biosimilars as best value biologicals. Look at different aspects than only the price. The price is one thing, but for instance, to give you an example, this is not really an innovation, but it is a very important aspect for hospital pharmacies. When you are in a hospital, you're treating a lot of patients, then the vial size of a product is important. Mm-hmm. So if you only have, let's say, a single dose for a patient, it's a nightmare for technicians to make all these infusions. And if you have a large vial that you can just make a lot of infusions, it's much more efficient, and you don't throw away drug. Right. So stability is another thing. Biosimilar companies are investing quite a lot of money to show that their product after reconstitution is more stable than the innovator product. That's an advantage for handling a drug in a hospital. So there are several aspects where products differentiate, but we have to train the pharmacist to see, and especially then the insurers, to see beyond the price. Insurers usually only know the price. And I have to explain them, mm-hmm. There are important differences between the products that are relevant also. Very good. Thank you very much. You're welcome, João. And it was a pleasure to be here in this beautiful city with the beautiful weather today. Thank you very much. Okay. Pleasure for us also. Muito obrigado por terem acompanhado mais um videocast. Até um próximo episódio.